Minority Leader Nancy Pelosi just speaking out on the CBO report on the Obamacare replacement bill. Let's take a listen.
CBO has reported that the Republican bill pushes 24 million people out of health care, off of health coverage. This is a remarkable figure. It speaks so eloquently to the cruelty of the bill that the Speaker called an act of mercy.
Okay, the White House out, Bre, saying that the CBO report is not believable, simply has it wrong, that the 14 million in that number, that they will choose not to have coverage by choice. They're going to forego, health insurance coverage if that mandate penalty goes away. And the Republicans out saying that those 14 million, if they forego next year, they could step up and repurchase health care coverage. What are your thoughts?
Right. Well, I think the CBO is full of it, and I think they have a long track record of pushing bad numbers. 10 years ago, they said that 23 million people would be insured through the Obamacare exchanges, and today, in 2017, that number is only 9 million, right? And a lot of these insurance plans that people have purchased through the exchanges are really crummy insurance. One of my coworkers, which does have insurance that she purchased through the exchanges, her premium went up by 96% this year, right? So I think it's very clear that the CBO doesn't know what they're talking about. They're speculating, and these numbers are bad.
Julie, I'm sorry, so sorry, we're running out of time, but quickly, President Trump just tweeting this out about Obamacare, saying, quote, if Obamacare is so great, why do they spend tens of millions of tax dollars to hype it? Bad. Hashtag repeal and replace. Your thoughts?
I think that this was a pretty damning analysis by the CBO of what we're terming Trump care. And you can say all you want that this will, cut the deficit, which would be true, but you're also cutting access to health insurance, affordable health insurance for a lot of populations who need it most. So you may say they're choosing not to participate in the health insurance market. I think it's because they're choosing to spend money on rent and food. I think that this is bad.